The biggest challenge in healthcare, and as it relates to the US, is really affordability. The US healthcare system is very much focused on transactions, quantity, volume, and we need to make a transformation towards both quality and value. It is critical that we make the transformation, and we're going to need the concerted efforts of all players to try to, in the healthcare system, to try to do that. There are a few tenets that probably could drive that transformation. We believe in empowering the consumer and bringing technology and providing much more visibility to the consumer so the consumer can make appropriate choices. Rethinking this, how we manage chronic disease. Chronic disease is a huge part of the healthcare cost in the United States. And we need to be thinking about managing for wellness and preventing people from getting sick, as opposed to waiting for people to get sick before they are fully treated. And finally, leveraging technology. There's so much technology out there that could basically allow for us to make the system a lot more affordable. It's unclear, what choices we'll make, because we have a huge increase when it comes to demographics. We have a lot more innovation today, and in some cases, the innovation is costly. So how do we make that innovation more affordable? And then finally, political choices. So it's a critical time, I think, in the US and in the world today. Clearly, we are at the critical time when it comes to biology, and there was a huge milestone with the sequencing of the human genome. That has made such a transformational difference when it comes to understanding biology. And there's a lot more to learn and to understand, but the progress, I think, is immense. People, or some of the literature asserts that every 2-3 years, we basically have a doubling of the medical literature out there. So the opportunity today is for us to be able to address huge challenges when it comes to some of the most needy areas when it comes to healthcare, whether it's Alzheimer's or cancer or diabetes or pain or immunology. And by the way, Lilly is present in all of them. So it is great to be working at a company that is fully focused on addressing these huge medical needs. We made a lot of progress in the last 10-20 years, but the progress that I see and the future to be able to have much more targeted precision designer drugs type of approaches, I think is truly immense. When it comes to emerging markets, we think about bringing our global innovation to emerging markets. In the past, emerging markets, we've tended maybe to think about some of our older, more mature products, and they were the ones that basically were the huge producers of revenue. Our approach is to bring the latest innovation now to the emerging markets, to try to do so simultaneously as we're launching also in all of our major markets. So speeding up the drug approval process is key, obtaining reimbursement, and finding ways to basically reach as many people in emerging markets as possible. So bringing our global innovation is number one. We cannot speak of emerging market without winning in China. So we have to win in China. And sometimes we think of China not as an emerging market, but as a developed market. But for this context, let's call it an emerging market. But to do that, we treat China differently from a capabilities perspective, and also thinking about how do we partner also with local Chinese companies to try to accelerate basically our penetration into what is a very vast and very significant opportunity. In China specifically, and maybe this is more of an exception, but we also tend to think about innovation, China innovation for China. So we've partnered and we've actually have developed products that are unique to China, for China. And we have a couple of very successful examples today with two important partners in China in the oncology space, for example. And it's the early innings of that story, but I think the start, I think, is extremely encouraging. So it's about innovation, it is about winning in China, and finally, it is about leveraging technology. And it is amazing to see how much technology can help patients and reach healthcare professionals in ways that maybe was not possible before. So the ability to leverage technology broadly, I think, is huge when it comes to ensuring that people can have access to healthcare, be more knowledgeable about medicines, and reaching them in new ways that we were not able to do so before. Healthcare today, I think, is undergoing massive transformation. And I will have really simple advice, but it's we have to embrace the change. So I would ask people to embrace the change and also to be a catalyst, to think of being an actual change agent when it comes to healthcare. Sometimes we feel like we're a cog in the wheel and all of this change happening. But we all can contribute to try to change how healthcare works, whether it's in the US, and each one of us can do certain things to try to make sure that it works better, whether it's in Taiwan or whether it's in Japan. The opportunities are endless. So I would ask for the MBAs to be bold, to think big, and to be an agent of change.